Okay, so this crash course is going to be focused on the electrolytes and fluid imbalances. So let's start with the basics first, which is the different types of fluid imbalances. So we have hypertonic, hypotonic, and isotonic. So a quick reminder, whenever we are talking about categorizing the different fluid imbalances, we are doing it with respect to the fluid that is on the outside of the cell, so inside of like the interstitial space. So I'll give you an example. So this one is hypertonic, right? We know that hyper means that there is an excessive amount of, we're talking about fluids, so this is an excessive amount of fluids. Don't get it confused and think that the cell, these are cells by the way, but don't get it confused and think that this cell that is swollen is the one that is hypertonic, because you're thinking of an excessive amount. You're thinking of an excessive amount on the outside of the cell. So if there's an excessive amount of that fluid, the H2O, on the outside of the cell, that means that there's not a lot of it on the inside of the cell, and that's why this cell is shrunken. Make sense? So let's do hypotonic solutions. So when we think of hypotonic, that means that there is a deficiency, a lack of fluid on the outside of the cell. So if it's not on the outside of the cell, that means it is it's inside of the cell. So this is why this cell is swollen compared to the hypertonic one that is shrunken. Isotonic is just like it's regular cell shape and size, because isotonic just basically means equal parts of fluid on the inside and the outside. So now we're going to talk about this in regards to dehydration. So there's also different types of dehydration when we think of these fluid imbalances. So we have hypertonic dehydration, hypotonic dehydration, and isotonic dehydration. So just use your context clues. So when you think of hypertonic dehydration, we said that meant that there was more fluid on the outside of the cell, which means that for the dehydration portion of it, that just means that we had a bigger fluid loss more than a sodium loss. Don't get distracted or confused. I know I just threw sodium in there, but whenever we're talking about the cells, just remember sodium is always higher concentrated outside of the cell. And whenever we're usually talking about fluid imbalances and electrolytes, you're always going to see water and sodium together because they kind of like follow each other. So for hypotonic dehydration, we have a bigger loss of sodium than water. And then isotonic, same thing. Isotonic dehydration is there's an equal loss of both parts, sodium and water. And then underneath, I just wrote like the different symptoms you would see. So in hypertonic dehydration, you would see sweating, because your body is losing all of the fluids and holding on to the sodium, the salt. And then dehydration be renal disease, which makes sense because if there's more sodium loss, that means that you are urinating more and there's more electrolytes in your urine. And then diarrhea and vomiting for the isotonic dehydration. Now we're going to move on to the different types of IV solutions in regards to these different types of dehydrations. I just listed them here. So we have normal saline. We know normal saline is 0.90%. And then we have isotonic IV. So of course you would use that one for this one. Hypertonic IV, basically an increase in osmotic pressure. Whenever you see osmotic, think of water, think of fluid. So you would use hypertonic IV for the hypertonic dehydration because you lost the water. So this is increasing the osmotic pressure. So you want to give that so that you can have more water and fluid inside of the cell again. Okay, so we have different categories of IV solutions as well. The main two to remember is just the crystalloid solution, which is the normal saline, and then the colloids. I remember the colloids by, I just usually write the first letter of the word first. So I write HAD, H-A-D, and then just kind of like fill it in. So we have heterostarch, albumin, and dextrin. And what these all do is they increase the oncotic pressure. So they basically move fluid from the interstitial space into the plasma. Now we're going to move on to blood transfusions. So when and why do we use blood transfusions? Usually for patients who have low blood volume. The only thing that you would use with, the only type of solution you would use with a blood transfusion or while doing a blood transfusion is normal saline. That is it, nothing else. You want to make sure that you are monitoring when you are doing blood transfusions. That is very crucial. You want to check the vital signs before you do the transfusion, and you also want to check the vital signs within 5 minutes after the transfusion started. So make sure that you set aside 15 minutes of your time to stay with the patient for those 15 minutes, because you're going to check the vital signs again at the end of that 15-minute duration. But you should expect to see if there was going to be any adverse reactions to the transfusion. It usually happens within the first 5 minutes. Before you even start the transfusion, you have to make sure that you have the right patient that is receiving the transfusion, and you also need to verify the donor of the blood transfusion too. And this is something that takes 2 nurses for verification. So you do have to have another nurse to verify all of these things with you. The transfusion in total takes 2 hours, no more than 4 hours. Okay, so it should not exceed 4 hours. And back to talking about those signs and symptoms if you have some type of transfusion reaction, if your patient is having one. It mostly is going to affect respiratory, cardiac, and then I have a few others here. But as far as the respiratory, look out for dyspnea, which is trouble breathing, shortness of breath, rales whenever you are auscultating the lung sounds, and then pulmonary embolism. It could be a sign and symptom as well. And then for the cardiovascular signs and symptoms, look out for tachycardia, hypotension, and JVD. The other, just look out for like if they are starting to itch, or if they say that their skin is getting itchy from possible dermatitis, or if their fever is elevated. Even if their fever is only elevated or lowered by 1, you want to make sure that you are monitoring that, because if there are any signs of symptoms or any changes at all, you want to immediately stop the transfusion. You stop the blood transfusion, but you want to keep the saline running, okay? Because you want to make sure that you are clearing all of that out. So you will stop. The first thing you will do is stop the blood transfusion, keep the saline running, and also do not discard the blood bag, okay? Because what you are going to do is send the blood bag back to the blood bank, because they are going to run tests and, try to see what happened. Okay, so back to electrolytes. We are only going to talk about 2 really, but there are 3 main. They're called like the electrolyte trio. So you have the sodium, calcium, and then magnesium, which we aren't really going to talk about, but I'll just say magnesium is for muscle relaxing. So this is my little cell again, just to remind you that calcium is going to be more concentrated in the cell, and then sodium is always more concentrated outside of the cell. Whenever you see potassium, think of the heart. So that should help you kind of use your context clues and be able to decide what type of adverse effects would you see, because it would be things that would be cardiovascular, right? Or what type of indications as well. So potassium controls heart contractions, and the normal range for potassium is 3.5 to 5. So if it's below 3.5, that is what we call hypocalcemia. So that means that your heart muscles are not contracting as much, and that is why the patient is going to feel lethargic. They usually give PO supplements for the hypocalcium, just to bring the calcium levels back up. And I know that they also have liquid calcium as well. And if it is more than 5, that is what we call hypercalcemia. So that's an excess amount of calcium levels, and that can lead to cardiac arrest. It's very dangerous, and that's usually treated with IV. One thing that the 2 things you definitely want to remember when it comes to treating potassium is you never want to IV push. We never push an IV. And always dilute it. Okay, you never give potassium through an IV alone. You always dilute it. Last but not least, we have sodium. So the normal range for sodium is 135 to 145. So if it is under 135, it is classified as hyponatremia. That just means that there is a decreased amount of sodium in the body, and it's usually excreted through the urine. That's why I put diuretics here, because a lot of patients who are on a diuretic medication sometimes have hyponatremia because the electrolyte is getting released when they have that excessive urine. If it is above 145, it is classified as hypernatremia, so an excess amount of sodium in the body. And signs of symptoms of hypernatremia includes muscle cramps and also an increase in intracranial pressure. Okay, and a way to treat hypernatremia is just to increase fluid intake so that you can dilute it, and then also just having them urinate a lot more so that they can excrete it from the body that way.